EMS.
Help, we're back here. Hurry, she's still not breathing.
Are you out here to the left?
I just got her out of her crib and she wasn't breathing.
If possible, have the bystander continue CPR until one of your crew members is in a position to take over.
How old is she?
She's 6 months old.
And when did you see her last?
About an hour ago before her nap.
Okay. Does she have any medical problems that you know of?
All right, so looking at this, Caitlin, what do you think about this doorway to patient PAT time?
Well, as we walk in, we can see that the kid is on the ground and appears to be fairly lifeless and unresponsive, so that speeds up our PAT more than we would on somebody who's sitting up and able to talk to us, and we can get all that information.
Right, so we're dealing with a
Sick.
or quick patient. All right.
Please help her.
I have no carotid.
Where you guys at?
She's not breathing. Over here, we have a 6-month-old, last seen normal about 1 hour ago. She's apneic and pulseless. We're going to start.
We've made it to the patient. We've completed our PAT, and we've determined that this is obviously a quick patient, but there's a few things that we need to do before we depart the scene. What are those?
We're going to go through our ABCDEs for our pediatric cardiac arrest. As you can see, when the crew walks in, they place their equipment where they can best access it and start setting up for their pit crew model for pediatric cardiac arrest as well.
That's right. And what are 5 things we need to do before we depart the scene?
So we're going to start with A, which is arrive, B, BVM, C is compress, D is drill, E is epi.
Right, not to be confused with your primary assessment XABCDE. Remember, restart the heart before you depart.
Breath.
One more time on the epinephrine.
All right,
1,
epinephrine.
2, 3,
We're
4,
going to give 1 to 10,000. It's going to be 0.8 cc's.
All right,
0.01 milligrams per kilogram.
1 cc syringe.
All right,
Breath.
narrow return.
1, 2.
All right, once you've gotten through your first 2 minutes and you've completed your 5 steps, now it's time to make a decision on staying in play or go ahead and getting the patient loaded up and going to the hospital. I think they made a good choice to go ahead and stay and work this code.
Breath. 1, 2,
15 to 2,
4,
very
5,
good.
6, 7, 8,
Complete
9,
time of
10,
recoil.
12,
1.5 inches of travel on the chest wall.
Breath.
Good.
Breath.
All right.
1, 2, 3, 4, 5,
Suction.
6, 7, 8, 9,
Make
10,
sure we
11,
don't get any
12,
gastric
13,
distension.
14,
Very
15.
good.
OG is placed.
Oh, excellent. Okay.
Breath. Breath.
On your next
1,
pause, I'll
2,
get the other
3,
one. Let me know when we have
4,
that epi
5,
in, and
6,
let's get her on
7,
monitor.
8, 9, 10,
Monitor's
11,
coming.
12,
Okay.
13,
When
14,
you get finished
15.
rolling, I'll do
Breath.
it.
Breath.
15 to 2. Excellent. Complete
One,
chest
2,
recoil, inch and
3,
a half of
4,
travel.
5, 6. What is our first shot
9,
dose? 10,
There you are.
12.
All right, Caitlin, so what do you think about their crew resource management? I think it's spot on.
They seem to be doing a pretty good job. They got somebody, keeping track of time, going over compressions. Somebody looks like they already put an OG tube in. They got the pads on. Somebody did their drill, their hand drill on this patient.
Right, because under 1 year old, what do we not do?
We're not going to use the actual drill.
That is correct.
Also
And
not going to use the QCPR.
13,
0.8.
It would be
See it? 0.8.
breath.
2 joules per
1,
kilo,
2,
15
3,
joules for our
5,
first
6,
0.8,
7,
right? 0.8. Excellent.
You got the
Very
epi
good.
bottle?
11, 12,
0.8
13,
cc's.
14, 15. Breath.
Got it.
Breath.
Excellent.
1,
Okay,
2,
got it.
3, 4.
If anybody's got a free hand, if they could pull up me in inline end
Epi's
side
going in. Epi's on board.
So you can see that the crew did their IMAC check before they administered their first epi, checking to make sure it's the right dose, the right patient, that everybody's in agreement, we're giving it for the right rhythm. Checked his hand heavy, make sure of how many mLs we're giving, and made sure everybody was in agreement.
7, 8, 9, 10, 11, 12, 13.
We're on round 5, is that correct?
Breath. Check rhythm, check pulse, 20 seconds.
Okay.
Give that syringe.
remember, when you are doing your rhythm checks, to make sure that we are switching compressors, even on the small patients.
Yeah, I'm looking for the 1 cc that you already used.
I got the 1 cc over here.
Okay.
Got it.
Cat nose on.
Cat nose on. What's our reading?
Breath.
The 60 cc would be right in here. And lid.
How do you feel about the
Right there.
BGM? Do you have good back?
I have really good back compliance. I have good chest rise. Breath. Breath. We're at 2 minutes. Check rhythm, check pulse. We're still lacing solid. Back on chest. When you're ready to swap, let me know.
Pull up our fluids.
So far to recap, BVM, drill, epi, we have one epi, 0.8 cc's.
Yep. And I have a second epi ready to go.
We're in 15 to 2, we have our next epi, 160 cc fluid bolus. That's what we need.
160 cc.
Yes, sir.
So we have everything in up to an epi.
Correct.
Okay,
We're
so
coming up on our second epi.
let's talk about transport. You guys, what are you thinking?
Breath.
I'm thinking we can bounce once we got our epi in.
I do too.
You
So
go with that?
we'll have our second epi. Why don't we have everything set up, package ready to go? After our second epinephrine,
We can do this
we're
a little
prepared
bit.
for transport.
1, 2, 3, 4.
We got a good end tidal reading, 28.
Yeah, you know what? I just doing this incorrectly. I'm going to pull it off the line.
Okay.
Breath. I'm comfortable transporting. We have IO access. We've gotten our first round of drugs on board.
11.
We've got decent numbers.
Let's keep high quality CPR,
breath.
inch and a half of
Breath.
travel.
Do we need to switch out
15 to 2.
CPR?
Yeah, we need to swap compressors.
8, 9, 10, 11. Ryan, I'm going to give you this epinephrine. Switch out.
Got it.
All right, let's
30
double
seconds.
check that volume administration.
Epi is going in.
Epi's on board, 0.8 cc's.
11, 12.
Epi on board, good.
Breath.
Okay, epi's in. Flushed.
Make sure that our pressure release valve is popped, so we don't
Ryan,
good.
Sam, 14.
All right, right behind you. Okay.
Breath.
1, 2,
All right, let's talk about some H's and T's.
8, 9, 10.
Let's get a full.
To avoid potential fluid overload on pediatrics, we're not hanging bags. Remember to reference the Hantevi for the correct dose and administer through syringe.
Good. Let's get a sugar on them.
10
Breath.
seconds.
Hydrogen ion acidosis.
10 seconds till rhythm check.
Toxins, trauma. Okay.
This is first 60 cc.
Of fluid, okay? And we'll have 100 cc fluid bolus after that.
Okay. 100 cc going in.
Asystole.
Asystole.
60.
All right.
Okay, good. We should be coming up on our next 2 minutes.
Breath.
I'm going to get some more information from Mom. Let's do a rapid trauma. Make sure we have no trauma.
Caitlin, I like how they want to take a moment to rule out any trauma. That's important, right? We got to put our hands on our patients to make sure that we are seeing the big picture and catching anything that we might have missed if we don't touch our patients.
Absolutely. We want to make sure we can rule everything out, and the only way we can do that is by exposing our patients and getting a full picture of what's going on.
Breath.
Excellent. Okay, guys. After this round,
15.
Let's rock and roll,
we're
right?
gonna package and
Yep.
prepare for transport. Okay.
Okay. Last 40 cc.
15.
40 cc's. After this, 40 cc's. We'll check pulse, check rhythm, package, and then we're gonna transport.
Great.
14, 15.
Breath. Breath. I'm gonna come over you.
Got it. All right. 160 cc's in.
160 cc's.
2 rounds of epi. We get ready for another one?
2 rounds of epi. We'll draw that up. Check pulse, check
15.
rhythm.
Breath.
Yeah.
Continue
Breath.
high quality CPR and transport.
And he's hardwiring.
Good.
When are we transporting?
We're gonna transport on our next pulse check.
Our next
15.
one, everybody's
Breath.
good with that?
Yeah.
Breath.
Can you
20
do
seconds
compressions
till
while
next
we're
pulse
walking?
check.
Mark, where's that?
14,
original epi?
15.
Breath. Breath.
It's I refilled it. You can just grab
5
this.
seconds till pulse check.
Go.
15.
Breath.
Stop
Breath.
CPR, check pulse.
Got it.
Brachial pulses.
I have no carotid.
When doing your pulse rhythm check, make sure that you confirm whether your patient is in a shockable rhythm or not. If your patient is in a shockable rhythm, remember to reference the Hantevi for the appropriate joule settings.
No carotid, no brachial. Okay, let's package them and begin transport.
Okay. Continuing CPR.
All right. We're good for an epi, right?
Are you ready to
Yes,
swap,
we're
Mark?
on.
You
Okay,
wanna
take a
swap
look at
with
this.
me?
0.8.
Let's
0.8.
we get the
0.8.
stretcher ready.
Back
and-
check.
yeah,
0.8.
let's
Back
get the
check.
Mark,
stretcher
0.8. See that?
15.
Breath.
Good.
Breath. 0.8 hurt.
You got the stretcher?
Got it.
Okay. You guys ready?
0.8 in.
0.8 in.
We do compression
0.8
while
on
we walk.
board.
We can do compression.
15.
Breath. Breath.
Comfortability with that?
I'm okay with it. I have.
I'll
great
carry the monitor if you guys
visualization.
want.
Breath.
I'm coming up.
Breath.
I got it. 2, 3, coming in. Very good. All right. Go ahead. Watch your cables. You're gonna have to situate this for me. Let's keep one person on the seal, one person on compressions, one person bagging. All right, compress. Compress. You got a bag?
Yep.
All right, I'm gonna come up around.
Move around.
I'm gonna switch our O's here.
Okay.
13, 14,
How are we for another epi?
2 breaths.
Breath. Breath.
All right. And whenever we're ready to rock and roll, you guys need anybody else? I'm good if you're good.
I'm good.
2 breaths.
Breath.
We got one more epi to give.
Is it 3 total for a kid?
6.
Or can we keep going?
No, we keep going.
We keep going, right?
Yeah.
So remember here, just like they talked about with our kids, we are not stopping at our 3 epis. We're going to continue administering epi as long as they're in cardiac arrest.
Remember, early notification is important to the receiving facility. So the minute that you can spare to make that notification, go ahead and do that so that they are awaiting your arrival.
Right, because we're pediatric. Okay, got it. Okay, we got the O's. Hand heavy. 1 year or 6 months?
6 months.
6 months? Okay, got it. 13, 14, 15. 2
Breath.
0.8 mLs.
Breath.
Okay.
0.8
All right.
mLs.
Listen, if you got the drugs over there,
5, 6,
I'll
7,
take over your compressions,
8, 9,
and then
10,
you can do that.
11.
0.8 mLs.
13, 14, 15.
Breath.
All right, 0.8 mLs. All right, so are we we capped at 3 or are we going to do continuation?
No, it's a ped. We don't stop.
Absolutely, good.
Breath.
Okay.
Breath.
We got our epis. You can just be easy on the bag.
Breath. Breath.
1, 2, 3, 4, 7, 8. Okay. We are due for our next epi, correct?
Okay. Correct.
Okay. Where are we at a pulse check wise?
We're at 8 minutes now. We're 30 seconds, 8.5. We're about 30 seconds out.
Right.
Breath. Breath.
Okay, here we go. All right, everybody good with 0.8. Okay. 0.8.
Breath.
0.8.
Breath.
0.8. Okay, here we go. 0.8 going in. You get a 10 cc flush. Thank you.
Remember, anytime we give a medication or perform a procedure, we want to complete our IMAC.
Breath. Breath. Bag compliance is still good.
0.8. We have our epi on board, followed by a 10 cc flush. We have our full fluid bolus of 160 cc's. Good. Okay. We've run through our H's and T's. We got 15 to 2.
Breath.
High quality CPR. And where were we on the pulse check? When are we doing that? What's our time
Pulse
frame?
check. 5
8
seconds.
minutes? 8 minutes? Oh, got it. Okay, got it. Yeah, we're almost there. Go. So let's
Breath.
keep oxygenation, circulation, ventilation.
6, 7, 8, 9, 10.
Still working asystole, cardiac arrest.
Breath. Breath.
Checking for brachial pulses.
Do we have brachials?
No.
Okay.
Okay.
Continue CPR.
Good.
Are you ready to swap on this next go around?
10, 13,
Yes,
14,
absolutely.
15.
Okay. Breath. Breath.
All right, let's try to keep one guy on seal, one guy on compression, one guy on bag, and let's do high quality CPR.
The death of an infant is tragic. Over the past 10 years, there have been 102 babies in Pinellas County that have suffocated while sleeping unsafely. That's enough children to fill 6 kindergarten classrooms. While each of the circumstances were different, they all had one thing in common. All of these deaths were preventable. Don't risk it. If you see something, say something. On calls, when we're going out into people's homes and we're dealing with a brother or a sister or a mom, a dad, grandmother, whatever, and we happen to see a baby in an unsafe sleeping situation, be the voice, be the advocate for this kid. Say something, educate the caregiver and educate the parents. Remember, one preventable death is one too many. The ABCs of safe sleep: alone, on my back, in my crib.